Hi everyone, I'm here today again. I want to talk about the hyperemesis gravidarum management and prevention. But before I go further, please kindly like, share, and follow my page. And you can get in touch with me on YouTube by the name Oluwakemi Ibitoye, on Instagram Oluwakemi Ibitoye. So I'll proceed to the talk of today. Hyperemesis gravidarum is an uncommon disorder that usually occurs in pregnancy, and it affects the first trimester of pregnancy. It's a situation whereby a pregnant woman vomits or have nausea in extreme, or it can be said that a pregnant woman exhibiting morning sickness in extreme. And this condition can lead to dehydration if proper care is not in situ. So what are the causes of this condition? Hyperemesis gravidarum is increased rapid secretion of serum level of estrogen and ACG, human chorionic gonadotrophin. So, and again, studies also said that again, it can be as a result of two, maybe when the woman is carrying a multiple pregnancy, and it can be as a result of presence of adaptive mold. So the woman may present this extreme vomiting and nausea. So what are the risk factors? This risk factor does not mean that the person will have it, but things that can predispose this person to have this condition is that if the woman is overweight, it can be disposed to have it. And maybe this woman this is the first time being a first time mother, it can have it. And let's say again, if the mother is carrying multiple pregnancy, they can have it. So, and again, what are the signs and symptoms of hyperemesis gravidarum? As in, before you said that this person, I think this person is having extreme morning sickness, is when maybe the person is vomiting 3 to 4 times a day. The person is having a loss of weight that cannot be explained for, and the person is feeling dizzy, as in weak, lightheaded, due to a result of loss of electrolyte and dehydration. See the person feeling showing sign of dehydration, you know that this person is having hyperemesis gravidarum. So what are the diagnosis, and how can it be diagnosed that this person is having hyperemesis? This person truly is this sign and symptoms, this thing he has said or what I have seen is having hyperemesis gravidarum is by history taking, what the patient tell you, as in take detailed history, when did it start, when have you been feeling it, and other things, to be able to rule out and to establish your fact that this person is having, and also doing physical examination, checking the patient from head to toe to be able to check for this sign and symptoms or the things this patient has said or this client has said, to be able to establish that this person is having hyperemesis gravidarum. So the next thing is that what is this treatment? The treatment actually it involves preventive measures, as in depends on your healthcare provider. You can encourage the pregnant woman to be taking vitamin B6 or ginger, depends on your healthcare provider, as I said. And again, taking small frequent meal. You should not take too much glucose meal. Your meal should be small. You can take it little by little. If you take, because sometimes some people who normally without not even being pregnant, if they take too much glucose meal, they'll feel full and they'll feel like vomiting. So take small frequent meal. If you take small now, if you are okay, stay small. After then you can go and repeat again and take if you feel like taking something. And these women too can be encouraged to snack on crackers. They can take crackers, cream cracker, the other one that is not sugary and that is not that is plain cracker. They can take cracker. And again, it depends on your physician. If digestion has set in before the clients present in the health facility and there's digestion, the IV fluid can be given, and the intravenous fluid can be given. And if this vomiting is still extreme, as in this client is still throwing up, as anything you take is throwing up, you cannot retain anything, they may place the healthcare provider may place the client for the meantime on total parental feeding, as in nutrition, as in nothing by mouth for the meantime, to be able to to stop the vomiting and the nausea, so that before the client can be able to resume food. And medication depends on your consultant or your client or your healthcare provider. He will be the one to decide the type of medication you want to give to you, because as you are pregnant, you don't take anyhow drugs. You take drugs according to prescription and according to a guide, because anyhow drugs can tamper the development of the child, so you need to be careful. So, and again, what are the prevention of this condition? How can it prevent, or can it be prevented? Studies said that there is no complete way for be able to say that this condition can be prevented, because there are some things, measures you can put in place to be able to control this issue. By one, as I said, eating small frequent meal. Don't eat too much glucose meal. Eat small, but maybe at frequent interval, but small. And again, you should take blank food. Don't take something that is too oily that can nauseate you. Stay away from things that can nauseate you. And again, you can also snack on plain cracker, to help you. Before you start taking your iron supplement, you should wait until when this nausea and vomiting has stopped before you can start. You should start taking your, especially the nausea, before you start taking your iron supplement, you should wait until when this nausea has reduced or it has stopped. And again, you should take the ginger and vitamin B6 according to recommendation by your healthcare provider. Don't just take it on your own. It should be that your healthcare provider will be the person to recommend it for you. This can also reduce the issue of morning sickness becoming worse or severe, and it can prevent morning sickness from becoming severe. So, and again, what is the conclusion of hyperemesis gravidarum is that hyperemesis gravidarum is a condition that is characterized by nausea and vomiting in the early trimester of pregnancy. That is not that life-threatening, but something that is not like that threatening to you and the baby. But when you notice that you are having this issue, please don't stay at home. Try to see your healthcare provider, because if you don't put things in place too, it can lead to dehydration. Dehydration is not good for you and both the baby. So please try. And if this condition persists, because it normally is self-limiting after first semester, this the system gets used to it. The hormonal level will be in the same level. It will be balanced. But if this condition continues to second trimester, please try to see your healthcare provider for proper care and management. At this point, I'm going to bring the talk to an end. Please don't forget, kindly like, share and follow my page. And again, also please try to follow me on YouTube on Oluwakemi Ibitoye and Instagram on Oluwakemi Ibitoye. So thank you very much. Have a good night rest.